President and CEO of Boston Children's Hospital. And I'm very much pleased to welcome Governor Charlie Baker and Commissioner Margaret Cook to Boston Children's. And especially pleased that we are here today to talk about pediatric vaccination. I know this is a day that we at Boston Children's have been waiting anxiously for. I just mentioned to the governor that we're in the Enders building. And this is the building named after John Enders, who led the work in the creation of the polio vaccination, the polio vaccine. So I think that that makes a difference in what we're talking about today. With the Food and Drug Administration authorization of the Pfizer-BioNTech COVID-19 vaccine for emergency use in children's ages 5 to 11, and the Centers for Disease Control and Prevention sign-off, we are prepared to begin vaccination of pediatric patients in Massachusetts starting tomorrow. And so this is great and exciting news. And Governor, I hope I didn't bury the lead in saying that. Dr. Frini Polanco-Walters of our Division of Adolescent Medicine is here, and she will speak to the safety and efficacy of this vaccine in young children. Suffice to say, with children under the age of 12 unvaccinated, they have been and are risk for serious disease from COVID-19. We do continue to see cases where children contract it, get very ill, and are sometimes hospitalized. This virus is extremely contagious and spreads rapidly. And I do want to stress, that's probably the most important thing that I will say today. Vaccination of children will protect them and will slow the spread of this disease to the unvaccinated and to other very at-risk individuals. Vaccinating children will reduce the toll of this virus on everyone. The availability of the vaccine in younger children offers a tangible opportunity for all of our children to return to more normal daily activities and routines, and that's critical to their well-being. The vaccine will protect them against getting COVID-19, a very real concern. And it is my sincere hope that a robust turnout for our vaccination efforts with children will also mark the beginning of a return to the routines, the typical school days, activities, and community supports that are so many of them have been missing and are so vital to their mental well-being. So thank you for joining us today. And I'll stop there and turn it over to our guests.
Good morning, everybody, and I want to thank you again, Dr. Churchwell, for hosting this event today. I would say the last time I saw Dr. Churchwell, he and I were getting our heads shaved together to raise money for, I think it was pediatric cancer, correct? And I'm glad to see that you seem to have fully recovered from that experience. I also want to thank Dr. Frini Polanco-Walters for being with us today. Grew up in Boston, went to Rhode Island for college, went to New York for medical school, and then came back to the Commonwealth to practice. And we're also joined by Acting DPH Commissioner Margaret Cook, who will also have a few words to say as well. I want to thank Children's not just for hosting us today, but for everything you folks do every single day here in the Commonwealth of Mass for so many people, not just in Massachusetts, but also for kids around the country and around the world. As everybody knows, the CDC approved the Pfizer's pediatric COVID-19 vaccine for children ages 5 to 11. Vaccines have started to ship to Massachusetts last week after the FDA issued its emergency use authorization, and pediatric doses are here and more will be coming. We don't anticipate any supply issues, which, as we all know, back at the very beginning of this were a significant concern. We continue to lead the way in vaccinations here in the United States, with over 5.5 million people in Massachusetts having received a first dose. And in Massachusetts, typically, if you get a first dose, you get a second dose, which has been a great statement not just about the vaccine delivery system, but about the commitment of the people in Massachusetts to getting vaccinated and to keeping themselves and their families and their friends and neighbors and coworkers safe. A big part of the success of vaccinations has also been the program for kids aged 12 and older who've been eligible for the vaccine since the summer. Over 80% of kids aged 12 to 17 have gotten at least one dose, and our youth vaccination rate here in Massachusetts is about 20 points higher than the national average. For months, we've been preparing to distribute vaccines across the state so that families would have easy access once they were approved. And over the past year, we've built a nation-leading vaccine distribution infrastructure that's grounded in our relationships with partners like local boards of health, hospitals, pediatricians' offices, community health centers, and many other healthcare providers. We relied on these relationships to ensure the pediatric vaccine is widely available to families in every corner of Massachusetts. Over 500 locations to start will offer the Pfizer pediatric vaccine, including pediatricians' offices, pharmacies, community health centers, hospitals, and community-based clinics that are sponsored by both the Commonwealth and by local boards of health. With this mixed model of providers, nearly every Massachusetts child lives within 30 minutes of a vaccine clinic. We recognize that local boards of health and municipalities have a critical role to play here. That's why we've reached out to all of them to coordinate this process and to give them the opportunity to provide vaccines in their communities. For any local board of health that hasn't signed up to provide doses so far, this is an open invitation to those that choose to set up a clinic at a later date. We also know that pediatricians will obviously play a really big role here in this process because they are, in fact, in many cases, the most trusted partner for parents and families as they make this decision, and that's why we're particularly pleased to be here at Children's to talk about this today. We understand many parents will want to talk to their family doctors and to their pediatricians about the vaccine. These medical efforts know that the vaccine is safe and has been proven to be highly effective, and they are well positioned to help parents understand the facts so that they can make the decision that's best for them to vaccinate their kids. We're pleased to be joined today, as I said before, by Dr. Frini Polanco-Walters, a pediatrician here at Children's, and in a moment she'll talk a little bit more about how the vaccine is safe and effective for kids. As of today, parents can make appointments to get their kids vaccinated, and just like vaccinations for adults, the process is simple and easy. For parents who want to vaccinate their kids through their pediatrician or primary care provider, we encourage you to reach out to your healthcare provider directly. Parents can use vaxfindermass.gov to book an appointment for their children at a pharmacy or a local vaccine clinic, and some appointments at pediatric offices or hospital systems will also be available on the state's VaxFinder tool as well. Users will be able to narrow their results on VaxFinder to find locations offering the vaccine. Many locations have appointments that are available now, and more will be added, obviously, in the coming days ahead. People who can't use VaxFinder or have difficulty accessing the internet can also call 211, similar process to the one we had before, to access the COVID-19 vaccine resource line, and they can book an appointment there as well. The call center is open Monday through Friday from 8:30 a.m. to 6 p.m. and on weekends from 9 a.m. to 2 p.m. Translators are available in over 100 languages. As a reminder, the only pediatric vaccine that's approved is from Pfizer. And just like vaccinations for adults, it will require 2 doses that are 3 weeks apart, approximately 3 weeks apart. We encourage you to book that second appointment when you make your first. We're obviously excited to get underway with this pediatric vaccination program because we know the vaccine has been proven to be safe and effective. It's also free and available to every family in Massachusetts. We have the highest vaccination rate in the country, and as a result, our hospitalization rates and our case counts are among the lowest in the country. We strongly encourage parents and families to get the facts and to make the call to protect their kids. If you have questions, absolutely talk to your child's doctor. We've come a long way. A year ago, We hadn't received any doses of vaccine, and we were in the middle of fighting a fall surge in cases and hospitalizations. Today, vaccines are widely available across the Commonwealth, and millions of people in Massachusetts have stepped up to get vaccinated. And as a result, everyone who gets vaccinated is protected from getting very sick from COVID-19. In many respects, it's that simple. We look forward to working with our partners in the healthcare community to make sure that every family has easy access to these vaccines. And we look forward to having a successful launch and campaign to ensure that kids between the ages of 5 and 11 have the same opportunity to make themselves safe and to be family safe as their older brothers and sisters and their parents and their grandparents. With that, I want to turn it over to DPH Acting Commissioner Margaret Cook.
Thank you, Governor, and thank you, Children's Hospital, for having me here today, because it's a really good day. Today we have another tool to fight against COVID-19, and that tool is a vaccination for children ages 5 to 11. We've seen over the past year that vaccines are safe and they're incredibly effective. They're the best way that we can protect our friends and our families and our loved ones. Here in Massachusetts, we have a long and successful history of vaccinating children against disease. 95% of children receiving their childhood vaccines by the time they enter kindergarten. Pediatricians have always been critical to these efforts, and DPH will continue to rely on these healthcare relationships, particularly pediatric physicians, to help protect our state's most precious resource, our children. Healthcare providers and pharmacies, as the governor mentioned, have already helped us get to over 80% of one shot in arms for children aged 12 to 15. But you know, and I know, we still have a lot of work to do. Fortunately, we have positive and effective relationships with our local boards of health, with our community health centers, and with Massachusetts schools. All of them have been tremendous partners in our efforts to vaccinate Commonwealth residents. DPH is working closely currently with the Department of Elementary and Secondary Education, and we've reached out to all the schools in the Commonwealth, and we've urged them to consider hosting vaccination clinics. We're also asking them to coordinate with their athletic departments and PTO and PTA organizations to encourage and promote the vaccine for students. As the Commissioner of Public Health and as a mom, I know that you have questions. So I urge you to seek out a trusted healthcare provider and ask them those questions. Get the information that you need to take this important step and get your child vaccinated. Our focus at DPH is on keeping kids safe, keeping them in schools, and keeping our friends and community healthy. I want to thank all the residents of the Commonwealth for stepping up to get their vaccines, and I urge them all now to take your children and get them vaccinated as well. Thank you for helping us take this next step in putting the pandemic behind us. Thank you. I'd like to turn it over to Dr. Polanco.
Good morning. I'm Dr. Frini Polanco-Walters, and I'm a pediatrician with the Department of Adolescent Medicine at Boston Children's Hospital. Thank you, Governor Baker, Commissioner Cook, and Dr. Churchwell, and all of you for coming today. We are This vaccine is safe and effective for children. Safety data from trials show there were no serious adverse reactions related to this vaccine. And the most common reactions were pain at the injection site, fatigue, and headache. We also know people are curious about the smaller dose for the 5 to 11 age group. Vaccines doses are not based on children's weight. like other medications are, but rather on the developmental stage of the immune system. The dose for children ages 5 to 11 is smaller. To be exact, it is 10 micrograms compared to 30 micrograms for those ages 12 and up. They will still receive 2 doses 20 days apart, like the governor mentioned. And even though it is a smaller dose, it is effective. Over 3,000 children participated in the clinical trials and demonstrated a 90.7% effectiveness in preventing symptomatic COVID with this dose. And even though it's smaller, like I mentioned, it is effective. And just as a reminder, we're in the middle of the flu season. It is safe to receive the flu shot and other vaccines at the same time as the COVID-19 vaccine. We also know that a big factor throughout the pandemic has been that children overall don't get as sick as adults with COVID-19. However, they are not immune to serious outcomes. And a small group of kids have had severe illness and even death. Some studies have shown they can spread COVID to other members in their family and put them at risk for severe illness. According to the American Academy of Pediatrics, since the start of the pandemic, 1.9 children, ages 5 to 11, have been infected with COVID-19. From this age group, more than 8,300 have been hospitalized, and tragically, 172 have died. The death toll in the past year puts COVID-19 in the top 10 causes of death for the 5 to 11 age group. We know that the benefits of this vaccine far outweigh the risk, and we encourage everyone to discuss their options with their pediatricians, ask questions, and please consider getting your child vaccinated. Muy buenos días para mi comunidad hispanoparlante. Yo soy la doctora Fridi Polanco Walter, soy una pediatra en el Departamento de Medicina de Adolescentes en el Hospital Boston Children's. Estamos muy emocionados de entrar en la siguiente fase de proteger a los niños contra el COVID-19. Sabemos que la familia tiene muchas preguntas y por eso quiero contestar algunas de ellas hoy. En primer lugar, esta vacuna es segura y eficaz para los niños. Los estudios no mostraron eventos adversos graves relacionados con esta vacuna y las reacciones más comunes han sido dolor en el lugar de la inyección, fatiga y dolor de cabeza. También sabemos que la gente tiene curiosidad porque la dosis es más pequeña para el grupo de niños de 5 a 11 años. Bueno, le quiero recordar que las dosis de vacunas no se basan en el peso como otros medicamentos, sino en la etapa del desarrollo del sistema inmunológico. La dosis para niños de 5 a 11 años es menor, 10 microgramos comparados con 30 microgramos para los de 12 años en adelante. Pero la dosis pediátrica también requiere 2 dosis separadas por 21 días. Y aunque es una dosis menor, es eficaz. Más de 3,000 niños que participaron en los ensayos clínicos demostraron un 90.7% de efectividad para prevenir el COVID-19 sintomático. También es seguro recibir la vacuna contra la gripe y otras vacunas al mismo tiempo que la vacuna contra el COVID-19. Sabemos que un factor importante a lo largo de la pandemia ha sido que los niños en general no tienden a enfermarse tanto con el COVID-19 comparado con los adultos. Sin embargo, ellos no son inmunes a reacciones graves a causa del virus y una pequeña proporción de ellos han tenido una enfermedad grave y han muerto. Algunos de los estudios han demostrado que los niños pueden transmitir el COVID a sus familias y ponerlos en riesgo de contraer una enfermedad grave. Según la Academia Estadounidense de Pediatría, desde el inicio de la pandemia, alrededor de 1.9 millones de niños entre 5 y 11 años se han infectado con el COVID-19. Entre ellos, más de 8,300 han sido hospitalizados y trágicamente 172 han muerto. El número de muertes en el último año coloca el COVID-19 entre las 10 causas de muertes principales para los niños de 5 a 11 años de edad. Sabemos que los beneficios de esta vacuna superan los riesgos. Así que le aconsejamos a todos hablar con sus pediatras, hacer preguntas y, por favor, considere vacunar a sus hijos. Muchas gracias.
Doctor, why don't you stay up there for a minute?
Okay.
Just get to the other side of you here. I would start with, whether you have questions to the doctor.
Doctor, what's your message to parents who still like you?
I don't mind, of course. My message to parents is to get their questions answered. It is important to know that this vaccine, we're not forcing anyone to get the vaccine. We're highly recommending the vaccine because we have seen that the benefits far outweigh the risk. As I mentioned, some kids, while tend to get less sick compared to adults, some kids have had severe illness, and some kids have died. So I highly recommend to ask their questions to the pediatricians and other people that they trust, and come to the Boston Children's website, because we have information there they can trust if they need more, if they have more questions than other people have answered for them. And but I recommend, making the appointment, getting the vaccine as soon as possible, and not delaying, because by delaying it, they may put their kids at risk of developing COVID. So, la pregunta es, para los padres que todavía tienen preguntas, para los padres que no están seguros si quieren vacunar a sus niños y quieren esperar a ver qué pasa con los otros niños, se les recomiendo que hablen con los pediatras. Es normal tener preguntas, pero sí les recomiendo que lo hagan rápido para que no pongan a sus niños en más riesgo. Porque, como ya mencioné, muchos niños se han enfermado gravemente, hemos tenido niños hospitalizados aquí y preferimos prevenir. Muchas gracias.
So the only rule we have statewide with respect to K through 12 education is that there's an 80% threshold. And if a school building or a school district can get over that 80% vaccinated threshold, they can make their own call with respect to whether or not they want to have masks. This January 15th date is designed specifically to give a lot of schools and school districts the opportunity to either continue to get kids vaccinated who are already eligible to get to that 80% threshold, or some of the adults as well, and to now have an opportunity to get kids from the age of 5 to the age of 11 vaccinated as well. But from our point of view, the big thing here is vaccinations work. They've been proven to be safe and effective. They've had a huge impact on hospitalizations, case rates, and sort of almost everything associated with life as we know it here in Massachusetts. And the only standard we have at the state level is if you can get to 80% in your building among staff, teachers, and students, you can make the decision about whether or not you want to remove masks. But you can't do that until you're eligible to get vaccinated. And that's part of why we're so excited about having the vaccine available for kids between the ages of 5 and 11.
When I was booking vaccination appointments on the Vaccinator website, is there an option for parents who are looking to vaccinate multiple children at the same time? We've been hearing from some parents that getting appointments booked, who have 2, 3 kids, could be difficult if they have to get them done at different times.
Do you know the answer to that one, Commissioner? Let me get back. I think I know the answer, but I want to make sure I get it right. So can we get back to you on that one, Aaron?
And the website is live for appointments
Yeah.
right now.
Yes.
And our vaccines actually going to arms today.
Yeah, yeah.
We heard from some parents who were just eager to get.
Well, we have places that are available to get appointments now. And if someone tries to get an appointment today, they will be able to do so at a number of locations around the Commonwealth. My only comment, without knowing the absolute specifics of the question you're asking, is to say that there are 500 sites around Massachusetts that have signed up to participate, and that the vaccines have been delivered by the federal government, and they will be rolled out. And if somebody wants to get an appointment today, they should be able to do that. If they can't get an appointment for today, they can certainly get one for tomorrow or the day after. And as I said before, they can call 211 as well if they're having trouble accessing an appointment through the website. But they should always call their pediatrician to start. And we've said that also from the beginning. Long time no see, John. Yeah.
There's a significant percentage of parents that don't want to take the risk with their little kid. And that a third of the parents feel that way, and doctors are trying to get the message across, but the reluctance is out there.
So I think that was a national study. I don't think we know what the numbers would be here in Massachusetts. I guess I'd say the following, and I would want the doctor to speak to this one as well. The one thing that is pretty clear about vaccinations generally and COVID is states that have high vaccination rates have low case counts, low hospitalization rates, lower rates of death. That data at this point is virtually undeniable. And we also have here in Massachusetts, as the commissioner said and as I said, about 80% of the kids between the ages of 12 and 17 who've gotten vaccinated already under the program that we have in place, which we think is terrific. We test kids in school every week in Massachusetts. We're one of the few states in the country that runs a program that's available to pretty much any school that wants to play. And we have 2,000 schools that are part of that pooled testing program that we run every week. And the positive test rate in that pooled testing program is less than 1%. And I think part of that is driven by the fact that we do have a lot of kids in Massachusetts and a lot of staff and teachers who are already vaccinated, as well as a lot of adults who are vaccinated as well. At one point in August, there were 9,000 kids under the age of 17 in Florida who tested positive for COVID. At that point in time, there were 250 in Massachusetts. And that, in my opinion, was a function of vaccination rates. So I can't emphasize strongly enough the relationship, which is just borne out now across all the data, that vaccinations absolutely reduce the risk of getting COVID, the risk of being hospitalized. And that is very much true at this point for every age group that's been involved in this process. Parents should absolutely talk to their pediatricians. They should talk to their family doctors. They should talk to their primary care providers. And I certainly have understood from the beginning of this, and we talked about this last January, that I understood why some people were nervous about this at the start of the process. But over time, as more and more people have been vaccinated, and more people have had the opportunity to think about it and to make their decision, we've continued to see increasing vaccinations here in Massachusetts. I mean, we still have some communities that are adding newly vaccinated people to their population every single month. And many of them are communities that were relatively slow to move early on in the process. Take Chelsea, for example. I mean, Chelsea's basically to the point now where almost 100% of everybody who's eligible is vaccinated. So I think the vaccines are proving themselves over time, but people should talk to their child's doctor and to their own doctors, and then make the decision based on that information. But I certainly hope, based on all the data that I've seen, that they'll decide to get their kids vaccinated, because I do believe that's the safest thing for them and for their children. But I would really like Dr. Polanco to speak to this.
Thank you. Yeah, I will say that that has been my experience from the beginning. A lot of parents who have questions, and I think it's very normal to have questions. And I invite the pediatricians that if the parents don't have questions but are not taking the step to vaccinate their children, to bring it up and talk to them and to discuss what are the barriers for them. Because as a mom of 2 children who are going to turn 2 tomorrow, I can't wait for that, to hear the news that the vaccine is available to them as well, to protect them. So I share my personal experience with them. When I got my vaccine, I share my experience with other patients and how they're doing, but we have to focus on answering their questions. And so I feel comfortable when they take the step to get them vaccinated.
Governor, you said earlier that 8% of kids ages 12 to 17 got one dose. I'm trying to put this, Mark Cook said 12, ages 12 to 15.
Mine was, I'm going to check, but I'm pretty sure mine was 12. Yeah, mine was 12 to 17. One of the issues with the data generally is the way it gets broken up into 12 to 15 and then 16 to 18. And we then have to sort through it to come up with the slices and dices. And there'll be a little variation on the margin there, but it's pretty fair to say that somewhere between 7.5 and 8 of every 10 teenagers in Massachusetts have had at least one dose, and probably close to 7 out of 10 are fully vaccinated.
My other question was, how many doses have you received from the shipments already started?
Yeah.
What do we have to be at now?
I think 380,000.
Last question.
But again, I don't expect there's going to be a shortage with respect to that going forward.
Governor, what's your administration's plan for meeting the 2016 clean energy law going forward in the wake of the Maine ballot question approval on Tuesday?
So, first of all, we're discussing this with both the folks at Avangrid and some of the folks on our own team as well to determine what the next move here might be. But I think the decision in Maine, to some extent, speaks to a much larger issue, which I've talked about before, with regard to the work that is being done and will need to be done to electrify those parts of our economy that are currently driven by fossil fuels, and that is transmission capacity and the strength and power of the grid, whether you're talking about wind or you're talking about hydro or you're talking about basically any other form of renewable energy. Transmission has got to be a big part of the discussion, because we're talking about literally in some cases doubling or tripling the amount of energy, electricity that's going to need to be available to do it. This is a challenge not just for us here in Massachusetts, it's a national challenge. It's why Secretary Granholm came out so aggressively for that project before the election. But we're obviously looking at the results and talking to Avangrid, and they and we will figure out what the next move is.
Do you feel the New England Clean Energy Connect project is effectively dead at this point? Or
No.
do you still see a tax on it?
No, I don't. I don't see it as dead.
Can you give us an idea of how many appointments are being booked so far among the 5 to 11-year-old age group?
I can get back to you on that one. That number changes like every few minutes. Yeah.
And then President Biden announced a January 4th deadline for big businesses to vax up in the workplace or mask up, basically. Are there going to be any resources available in terms of getting those testing kits to Massachusetts businesses, and is the state going to play a role in that?
So there are two questions associated with the testing kits. The first is the feds have gotten a lot more, in my opinion, serious and aggressive about appreciating the value and the importance of rapid tests. We've done many things in this country very well from the beginning of the pandemic. Other countries, I think, did a better job of getting ahead of us on very cheap, very accurate rapid tests. I mean, they're everywhere in Europe, and they cost $1. And I do believe there will be significant resources available this fall. And when I say resources here, I mean test kits, cheap ones, different kinds of ones that we've had available historically. Not just for employers, but for families and sort of everybody, to put a much bigger and broader emphasis on the importance and the value and the utility of rapid tests. They've gotten a lot more accurate. They've been proven in Europe and in the US to be enormously effective at helping people deal with this question about, do I have COVID every single day? And I'm looking forward to having a much bigger collection of choices and options for people associated with those test kits shortly.
Thanks, everybody.
Thanks for coming out. And again, thanks to Children's, and thank you, Dr. Polanco Walters, for your presence as well.